Good morning. I'm Pat Croce, and this is the American Cancer Society's HEALED Community Gathering. HEALED, if you're not familiar, stands for Health and Energy Through Active Living Every Day. And our treasure chest of gifts for you and many others is this gathering. We get together every Wednesday for an hour with wonderful, dynamic guests, many of which are survivors of various forms of cancer. 2, there's the research that the $2 million that we've raised so far is going to play a big part in down in Atlanta with 400 cancer patients to see how HEALED, Health and Energy, can be activated every day. And survivors then tend to survive with a higher quality of life. That should be completed in about a year. And now, third, another HEALED gift. It starts this week. 6 ABC mindfulness moments on 6abc.com or wherever you see 6ABC. It's 60 to 90 seconds of just mindfulness tools, practices, exercises. In spirituality, they're called sadhanas. A sadhana, where I take you. I wrote them, 6ABC produced them with me, and you'll enjoy them. And they work. They work so that they can help to alleviate stress, anxiety, worry, psychological pain, not physical pain. The Buddha many years ago said, pain is inevitable. Suffering is optional. And that's one of our major intentions here. And we start each gathering before we bring on our guest with a moment of stillness. And we can all practice that right now. And how we do that is I have this little Tibetan bell, and all you do is lovingly, gently place your attention on the sound of this bell. Ready? It's like the doorbell to our HEALED gathering. That's right. Leave all of your baggage at the front door. It'll be there when we're done. And come in without any judgment, without any criticism, without any blame, without any worry. Just like you were focusing on that sound, you were in the present moment. So for the next hour, be with us. We will have a hard out at noon Eastern time, so you can plan your day every week, whether you're watching us live on Facebook or what's the other one? YouTube. Yeah, that's the one. Or you can always see it on 6abc.com. I know a lot of people watch on the weekends. And it gives me great pleasure today to always bring on these guests who volunteer their time to share with you, anyone who's touched by cancer or who has been touched by someone who's been touched by cancer. And who's that? It's not 6 degrees of separation. There's got to be 1 degree of that. And my first guest is he's a retired surgical oncologist and the medical director of Virtua Health Systems. So this guy's a brainiac. He knows his stuff. In addition to that, I'm a new volunteer with the American Cancer Society. This guy has done 40 years of volunteering with the American Cancer Society, so much so that the World Health Organization's Global Breast Cancer Initiative has asked him to come on the board. And he'll share with us why he is so active, not only as an oncologist, but with the American Cancer Society, because something so dear to his heart, like all of us, has been tugged on the heartstrings. But he didn't sit back. He thought he would take initiative and get involved. Dr. Baskies, this is Dr. Arnold Baskies.
Hey, Pat, how are you?
I'm doing great, Dr. Baskies. It's great to have you here. And before I ask about any family member, I'd really like for you to journey us in what was the impetus to become an oncologist and a surgical oncologist.
Hey, Pat, it's an interesting question. I've been asked that on a number of occasions. So let's go back to 1973 or so. And I was in medical school at the time, and I was going to be an orthopedic surgeon. I had actually, and I know this isn't going to sit well with you, the chief of orthopedics at Boston University Medical Center was the orthopedic surgeon to the Boston Celtics, who are, by the way, part and parcel of my being. But at any rate, I'm a Sixer fan anyway. But I was all set to become an orthopedic surgeon when my grandmother, who was very, very close, I was very close with, developed a mass in her abdomen that I diagnosed as a third-year medical student. And that turned out to be a very large perforated cancer of the colon. And I knew I wanted to be a surgeon, but my life changed at that point because my grandmother had colon cancer, and the guy that I wanted to model my career after was the guy that operated on my grandmother. So I completely changed my course and decided I'd go from orthopedics into surgical oncology. And I was lucky enough to be accepted for fellowship at the National Cancer Institute. And that began my journey in the world of cancer. And I've never looked back.
Wow. So if you don't mind, I love those indescribable moments when you decide, I'm going to switch, whether in your bedroom or taking a walk. Take us back just to that moment of presence when you just had this intuitive wisdom to say, no matter how much you liked orthopedics, oncology is a totally different realm.
It is. And that moment was, it's engraved in my mind, actually. I've not discussed this in public before, so you actually brought out a very interesting point. It just was a stark realization that I wanted to fight this disease and to do everything that I could do. So I did research. I began a research career at the National Cancer Institute. I got very involved with immunotherapy to harness our own immune cells in order to try to battle cancer. And that's what I'm doing now, actually. And by the way, you said I'm retired. I'm not really retired at all. I'm very active, and I see patients at a clinic in Cherry Hill.
Sorry, they told me you were a retired surgical oncologist.
You're right. That's okay. But my wife would argue that I'm not retired at all.
I'm sorry.
No, that'd be sorry not to be retired. But no, that realization, seeing my grandmother in pain and unable to work, she ran a huge business, by the way. She was an immigrant woman who went from nothing to creating an empire in Cambridge, Massachusetts. And
excuse me, no bark. Sorry.
That's okay.
I tire them out. I tire the two dogs out, Dr. Baskies, so they don't do that for some reason. Who knows? It was a deer walking across the front lawn.
There you go. So anyway, my grandmother was a life force, and she was now bedridden with this pain and this big mass that I could actually feel when I examined her. And I insisted that she go to the hospital and she'd be taken care of. She didn't want to because she's a very tough woman.
Were you allowed to be in surgery when the doctor operated?
Actually, no, but I was allowed, but I didn't need to be. And the guy that operated on her was just a phenomenal surgical oncologist who had trained at the National Cancer Institute. And that's one of the reasons why I changed my course.
It's always great to have mentors, isn't it?
Yeah, mentoring is something that I take very seriously. I've mentored a number of people, but you're right. One of the things I enjoy most in my own life is helping people in their own careers. And I've done that on a number of occasions. It gives me great, great pleasure to do that.
So tell us now, 40 years you've been with ACS in a variety of ways. How are you feeling about the progress that the society's making?
Well, when I graduated medical school in 1975, sounds like a long time ago, but it really isn't. I'll give you an example. The 5-year survival rate for breast cancer, for instance, was 75%. That meant that 25% of women were dying from breast cancer. We now go to 2021, and the overall survival in breast cancer is now well over 90%.
Oh, that's wonderful. That's great stats.
Oh, yeah. And we can look at a number of cancers. The first cancer that was cured without surgery. Remember, if we go back to the 1920s, 1930s, 1940s historically, the only way to treat cancer was with an operation. If you couldn't operate on it, you couldn't cure it. You had no trouble. You had no chance of curing it. There was no chemotherapy. There was no radiation therapy. Adjunctive therapies with meditation, it said none of that existed. But the main treatment that we have for cancer today with chemotherapy, radiation therapy didn't exist. So treat patients who had lymphomas or leukemias, they were going to die because there was no treatment. And then something happened. A great event happened. Vince DeVita, who was a researcher at the National Cancer Institute, came up with a cocktail, if you will, to treat a disease called Hodgkin's disease, which is a type of lymphoma. And lo and behold, he was the first person to treat cancer successfully without having to operate on it. And that really was a world-changing event. And so the world changed when Vince DeVita created CHOP, if you will. That's the acronym for the chemotherapeutic agents that are used to treat Hodgkin's disease. And radiation therapy came along and is now refined, as you know, so that we have all kinds of modalities in the world of radiation therapy. So in a very short amount of time, remember from 1970s to 2020, we now have immunotherapy, we have targeted therapies, we have proton beam radiation therapy, we have all kinds of other modalities in radiation. We have all kinds of ways to treat cancer that never existed before. So now the overall survival rates, if we take all comers, is close to 70%, when in the 1930s it was 30%. So yeah, we have a lot to celebrate. We also have a long way to go to get even more people treated and giving them more of a life than they would have had if they lived 100 years ago.
When do you think the screening, and none of these questions I've had planned, I went way off. Where did the screening come in, and the effectiveness of the screening from whether it's prostate, breast? This came in you feel that this has helped in this change of the death rate?
I do, for a whole bunch of reasons. One of which is screening makes people more aware, just in general, that they need to do something in order to find out if they have a problem. We know that in the world of colon cancer, that screening has made a tremendous difference in a number of ways. Not just because of colonoscopy. We know that lots of things have happened that have changed the world in terms of screening. One of them being colon cancer screening, now lung cancer screening, and of course breast cancer screening. And those three have made a difference in terms of finding disease. But in the world, in the case of breast cancer, we can one of the biggest advantages a woman has, for instance, getting screened with mammograms, is to determine whether they are at risk to develop breast cancer. So we can actually, in some instances, make a difference because we identified a woman at risk because of the findings on the mammogram, not necessarily because we found a breast cancer to be present, but the changes on the mammogram can indicate that a woman is at high risk, and we can do something to lower that risk.
What do you normally do?
Well, if we identify a woman having a precancerous lesion in the breast, something on mammogram with microcalcifications, for instance, that turns out to be what we call atypical hyperplasia, we can give them a medicine to take, a simple drug that will decrease their chance of developing breast cancer by over 80%.
Wow.
Yeah, so that's a big difference. We can also find changes in the breast that would have become cancerous later on and excise those in what we call in situ disease and make a difference in terms of them developing breast cancer later on. And that's made a big difference.
This month of September is Childhood Cancer Awareness Month.
Yeah.
And I know you've had, not only through patients and through your activities with the ACS, but a personal relationship with someone who had cancer. Can you tell us about Maddie?
Yeah, very personal. So in 2017, the Peter Principle was involved. You reach the level of your level of incompetence. So in 2017, January of 2017, having been involved with the American Cancer Society since they invested in me and my research in the 1970s, I rose to become chairman of the board of the whole American Cancer Society internationally. And it was a great day. I gave my speech and I was invested in running the board, et cetera. And then in March of 2017, 3 months after becoming chairman of the board of the whole Cancer Society, something which I was very proud of, I was on a train from and getting off at Penn Station with my wife, and we received a phone call from my son-in-law, who had our 2-year-old grandchild in the emergency room in Chicago with a paralyzed child suddenly. And we've been dealing with what was thought to be a viral illness, because she was very lethargic and really wasn't moving around very much for a couple of weeks. And my daughter and my son-in-law became very concerned. They took her to the emergency room at the request of their pediatrician, and she was paralyzed on the left side of her body. And so I got off the train. I'm walking on 34th Street, and I'm in New York because the next day I'm supposed to present an award to a high-level New York State government official for work they had done because of screening that New York had. So in recognition of that, that's why we were in New York. We get off the train in Penn Station. I'm right by Macy's, walking across town with my wife. I get this call that my granddaughter is paralyzed, and the MRI looks like it's a tumor in her spinal cord. So I look at my wife and we say, well, we're getting back on the train. We're going to we'll go back to Philadelphia, and we'll live in the Philadelphia area. We'll get on a plane to fly to Chicago. This is a Thursday night. On a Friday morning, we took the first flight out. I got to see my granddaughter, who was paralyzed, and talked to the neurosurgeon, looked at the MRI. And as a surgeon, I was very impressed with that MRI. She has a tiny spinal cord, and there's a tumor sitting in it. And I said to myself, well, one of three things is going to happen with surgery. Either she's going to come out and she will be quadriplegic, or she won't make it through the surgery because it was at the highest level of her spinal cord, or something that is unexpected will happen. And I couldn't discuss that with my wife and my in-laws because how can you talk about this? So I'm sitting there, and 4 hours later, they had gotten the tumor out of her spinal cord in what was a very, very technically difficult procedure. One wrong move and she would have been dead in that operation. And she came out of it, and I'd seen her before she went into the operating room, and she was unable to move her left leg or her left arm. And now she was actually moving her fingers in the recovery room. Truly a miracle. We were told that it would be months before she would walk, and within a week she was running. But I knew that this was a highly malignant tumor. The pathology report that I was with my daughter when she got the report, and I can tell you, as a surgeon and as a surgical oncologist, I knew exactly what was going to happen here. That chemotherapy would be involved, and she got every single drug you can imagine over the next 9 months or so. But I knew that the result would be that this tumor would recur, and it did. And in January of 2018, roughly 9 months or so after she was diagnosed, we buried her, and it was a very difficult day. And to this day, we have a scar, all of us in our family, but nevertheless, that's a scar that will be there. We can feel emotionally, but we've moved on. And my daughter and son-in-law have been amazing. They now have a 4-year-old one. And can you imagine that when Maddie, who was 2, was diagnosed, my daughter had given birth to her second child, and so she had a 2-month-old and a 2-year-old at the same time. My wife moved to Chicago for that year to help them. I was going back and forth on weekends. And so our family came together, which was very good and very helpful. But nevertheless, it was a difficult emotional journey for all of us. And somebody said to me, it was kind of funny, ironic in a way. They said, you're chairman of the board of the whole American Cancer Society. Don't you get some kind of a break with this? And I said, no, nobody gets a break with this. It's kind of an interesting comment.
Thy will be done, right?
Yeah. And
Thank you. Thank you for sharing that. And I'm terribly sorry that you had to relive that memory.
no, that's something that we all, you mentioned earlier that we're all touched by cancer in one way or another. And that's one of the reasons why I was driven during my year as chairman of the board and I was going to give it up and my wife said, no, you've got to do it in your own way, something that you can help other people. So,
So Maddie's spirit lives on.
Yes. And my daughter and son-in-law, they now have a wonderful 4-year-old who is running and jumping, and but they feel the pain every day. But they've gone through this, and I'm very, very impressed with them because they've been able to get through it so well. And more importantly, they've started their own little foundation, not only supporting the American Cancer Society, but they have a thing called Dancing While Cancering, which supports children with a backpack and all kinds of goodies inside. So every child now at 20 hospitals in the United States gets this backpack so that when they have an inpatient experience, in that backpack are musical instruments, a speaker, maracas, and streamers so they can decorate the room. And every child at these 20 hospitals gets this very, very nice backpack to try to lighten up that load. If you want to see something incredible and very moving, visit a child pediatric ward with kids that have cancer. It's very moving. It's bad enough as an adult to go through this, but as a child and a family, there's nothing I've ever seen like it. And it's very hard to watch, but the bravery of these people going through this, the families, the patients, are something that you can't even imagine.
You can't imagine. I can't imagine. And the organization is dancingwhilecancering.org. So if you're interested, please go online, dancingwhilecancering.org. And if you'd like to make a donation or see a little bit about what Scott and Pammy are doing. Pammy, is that what it was?
Yes.
Yes.
Yeah.
Scott and Pammy are doing with the spirit of Maddie.
Right. And to make matters even more impressive, the Cancer Society is now partnering with St. Baldrick's Foundation, which is the number one funder of pediatric cancer protocols at various hospitals around the country. And so St. Baldrick's has become the American Cancer Society's pediatric cancer fighting arm. And so, I look at.
And what is your role there? Because I have that in my notes, St. Baldrick's, and you brought it up. Thank you.
So I chair that alliance, if you will, and we've raised $4.4 million to date in the last 2 years, specifically to fund pediatric cancer research. Listen, pediatric cancer, this is, as you mentioned, it's this month, it's the awareness of it. And just think about this for a second. There are 43 children a day in the United States who develop cancer. That's about 2 kids an hour. And every 2 minutes around the world, a family hears the devastating words that your child has cancer. Childhood cancer isn't just one disease. There are 12 major types of pediatric cancer and over 100 subtypes. The treatment outcomes for children, however, with cancer, and you'll be hearing from somebody that I know very well about this, have made tremendous improvements over the last 50 years. And because of the research that's already gone on, more than 80% of children will survive 5 years or more, but there's a price to be paid for surviving. 2 out of 3 kids who will experience a late side effect from the treatment. And those side effects can be devastating, with heart attack, stroke, liver failure, hearing loss, visual loss. So it is a tremendous burden that children and families have once they're diagnosed. But we've made a lot of progress. We're hoping to make more progress. And I'm really grateful to you for discussing this whole area of pediatric cancer, because it means a lot to the American Cancer Society. It means a lot to the St. Baldrick's Foundation, and both groups are working together. That's one of the real good things about this partnership, is that, one of the problems we have in the world of cancer, to be honest with you, is we have a lot of competing organizations that are trying to get those research dollars and spending a lot of money to do it. So this partnership we have with St. Baldrick's is incredibly important and incredibly effective, because we've shown the world that two cancer organizations can work so closely together. And I'm very proud of that. And we put that together, actually, that alliance, while I was chairman of the board of the American Cancer Society.
My man.
Yeah, so I'm kind of happy about that.
Well, Dr. Baskies, I'm going to ask you to sit on the bench for a little while, but
Okay.
I want to thank you. I want to thank you for your strength, your vulnerability, your honesty in sharing a heartbreaking story, and your brilliance, because you put together in such a fun, enjoyable way of what is so devastating to families that you can't even talk about it, but you mention it in such a way where the spirit of these children who have been diagnosed with cancer and maybe not survived cancer live on in all of us, so that we are dancing and celebrating in life and with the memories of those we love. Thank you.
No problem, Pat. And I want to thank you again for bringing this kind of information to the public. It's very important.
Well, Dr. Baskies, you know this American Cancer Society, and I worked with JDF for a long period in multiple sclerosis. I knew nothing about the American Cancer Society. Although my dad died of prostate cancer at age 64, my Aunt Corinne, my favorite aunt who was a nun, died of colon cancer just about 3 or 4 years ago. But I really didn't know much about cancer at all, not at all. And this has just opened my eyes to a whole different realm of people, of love, of caring, of truth, that I'm just lucky to be part of it.
Thanks, Pat.
Thank you, Dr. Baskies. Now, someone that Dr. Baskies was talking about, because it is Childhood Cancer Awareness Month, is someone who had cancer when he was 7. His name is DJ Carlino. He's presently the Senior Director of Corporate Relations for the Philadelphia American Cancer Society. So we got 2 ACS gangsters with us, people part of the ACS gang, who are just remarkable because they spend their time trying to make people's lives better, with less suffering, with more smiles. When he was 7 years old, DJ was diagnosed with acute myeloid leukemia. Then he went in remission. Well, that's always a good sign, until 2 years later, it came back. First time, he had a 50% chance of survival. Second time, 15%. So I'll let DJ tell his story, but it just amazes me how, and it's a great story because it gives you that. We talked about role models with Dr. Baskies. Here's a role model of someone who embraced his diagnosis, did what it was necessary to do, but never left a positive attitude. That is that element that we can't put our finger on. DJ Carlino, please come on.
Thanks, Pat. How are you?
I'm great, DJ. Thank you for joining us today. And I love having you and Dr. Baskies on, two of the. We rarely ever have anyone who's with ACS. Sometimes we had the researchers, or sometimes we had someone who gets involved in the community relations. But for an oncologist and a survivor who's now doing the corporate relations for ACS, tell us, before we get into your present role, your diagnosis, and where were you? What was it?
So I was 7, like you said in the prologue there, and I was having terrible neck pain, and like there were 2 or 3 days where I could not move my neck, and my mom was very concerned. She was actually a pediatric nurse practitioner, which is probably the only reason I'm here today, and so we went into the hospital, we went to my primary, got a blood test. It came back, and we were at CHOP. They went home and packed up, and we were at CHOP that night. I immediately had a spinal tap, figured out that it was AML. and didn't leave the hospital for a month or two after that, 2-week break, and it was chemo all through then. And after that, I was in remission. Went back to second grade, finished the whole year, kind of had a great time. And then in the summer of when I was a second grader and a third grader, I relapsed. And I just remember asking we were in there with my previous oncologist, and I was like, knowing what I had just been through, I think that was the hardest realization, having to do it again. And because when I was 7, I had no idea what was going on, truly didn't. And I don't remember much because of the treatment that I was on, which is I'm pretty thankful for. And so going through that, hearing that again, and actually knowing what it meant, that was probably the scariest moment of my life.
When did you know at the age of 9 that you had this relapse? When did you know that the cancer had returned?
That's a good question. I think it was just in a routine. I would go back to the oncologist every 3 months.
It wasn't symptoms.
It wasn't symptoms. No. I remember saying to my dad, me and my brother had bunk beds, and we were going to bed, and we were going to get blood work the next day because something had come back. Either my white count was off or something like that. And I was like, Dad, I'm not worried because, I don't feel bad. Nothing is like feeling wrong. So like, I'm going to sleep fine. And, went to the hospital the next day, and they kind of brought us into the room and said that, I had relapsed, and, we would have to find some other course of treatment.
And what other course did you use?
So we did chemotherapy and then full body radiation. So
full body.
Yeah, and then
for how long? Do you remember?
I was in there for a month, and so that was to have a bone marrow transplant, and so it was chemo, radiation, and then a bone marrow transplant, where some lady in Germany was a perfect match for me because nobody in my family was. And so that was also one of the lucky swipes of my life. So yeah, I was in radiation was a month. I was in complete isolation in the hospital room for a month. So only my parents were allowed in, and every nurse had to wear a mask because basically they wiped my body to zero in order for the new bone marrow to take its place, and go through the transplant cycle.
Wow. So how do they find a donor? How do they go in international search? How do they do that?
Well, so there's a couple different registries that you can sign up for to be a bone marrow donor. And so basically it just takes a spinal tap, and they pull out your bone marrow, and then they would transfer it in. So they have a registry that's a national and global registry. And I should know this, and it's blanking me. Be the Match. That's the kind of organization that does a lot of the cross-referencing and things like that.
Have you ever been in touch with this German woman?
So yes and no. Because of the regulations and some of the HIPAA, we were never allowed to kind of formally meet or talk over the phone. But I did exchange 2 or 3 letters back and forth with her in Germany, and she, spoke in her broken English. I have them somewhere, and it was so long ago. But I mean, she's the reason I'm here, and it doesn't happen all that often that there's a perfect match, especially outside of the family.
I think it's beautiful. I think that's a miracle that, someone from across the world.
100%.
Wow.
Yep.
So tell us about the support system. You're talking about a child with cancer, not once, but twice, and has to go through this variety of treatment plans, especially ending with bone marrow transplant. What was your support system like?
It was everybody. It takes a village was never more apparent. I mean, my mom and dad were always there. I think my brother and sister got the brunt end because, one of them was always at the hospital with me. One of them always stayed the night with me. And so they spent many a night with my grandparents, both sides, who would take care of them, my aunts and uncles, neighbors, our friends. I mean, I remember having, not that I ate any of it, but people would bring over dinners and all of these things to just help kind of, like you said before, ease the pain a little bit, ease the burden, because it's a full-time job for, my mom and dad and family, core family, plus my grandparents, to just be able to keep things moving, not only for my life, but for everybody else's. And so that's—
Were you in pain? Were you in pain at that time?
There were definitely spouts of pain. I mean, I remember having a morphine pump. So there was definitely pain.
See, we don't talk about that. Here's children going through cancer, not only the cancer diagnosis, but the treatment plan, whether it's chemo, radiation, and or surgery, that comes with it a basket full of whoop ass.
Yeah, and I mean, like I said before, I think that the pain actually blocked out a lot of my memory, and so I can tell you, my mother definitely saw me in pain, and my family, which I think is probably harder than actually going through it. But it built up a decent pain threshold for me, so that's something that
bet.
I can,
So tell
I
us,
can hang on.
DJ, tell us about any side effects from the cancer or the cancer treatment.
Where to start? So
that many?
Yeah, it affects and has affected pretty much every aspect of my life up to this point, and will forever. So probably one of the first psychological side effects is all the PTSD from being in hospitals. Every time I go back for something, just the smell of kind of the ammonium or whatever the cleaning products they use in the hospital, I immediately get a headache. That's pretty minor, but in terms of my diagnosis, one of the things that doctors say is they really don't have any idea. They have nobody to compare me to. So there's no data further out looking, as I turned 20, 30, 40, 50, all the way out. There's no data or comparison to kind of even project any outlook. Some of the side effects that I specifically deal with are cardiomyopathy, but I have ultrasounds and cardiac tests every year. That will continue for the rest of my life. I have a higher risk of cancer for a lot of different ones because of the radiation, specifically thyroid cancer, which, they could just take mine out because it's not working anyways.
What do you mean it's not working?
I forget what the actual medical term is, but I take a pill that does the job of of what my thyroid would do. It's pretty common. And so it just doesn't secrete the right, whatever the toxins are that it does for your body to keep moving and do those things.
Well, and I see the bracelet. I see you have our Healed bracelet on.
I do.
I say yes. And for everyone who's watching, I thank all of you. I thank all of you who have gone to acshealed.com and put in a donation from $25 to $25,000 for this one little bracelet with the green bead, that we're all in this with DJ together. We're all in this together, one being, many expressions of the one essence of being. And I see it on DJ, and I forgot already to thank our sponsors, our leadership partners who have invested in this Healed movement, and 6ABC, who is our media sponsor, who without them, we would not be getting the notoriety that we're getting. And Healed, I want to lead into the question with you, DJ. Health and energy through active living every day. How is Healed a part of your survivorship?
I mean, it has to do with everything. In terms of how my body reacts, I have to keep it in a much different state than a lot of my, when I was in college, I was going to the gym every day, working out, eating healthy, all the things that sometimes are the antithesis of being a college student. That includes, I have high cholesterol, high lipids, all these different things that I've been taking a statin since I was, 18. Whereas usually when you're, 65 is when I was on the same medicine as my grandmother, who was 80 years old, when I was 25. And
how old are you now?
I'm 30.
tell me, how are you dealing with this? What is your mental attitude like?
I mean, my mental attitude has always been,
I don't care what it's always been. I want to know right now, what is your mental attitude?
right now, it is always to look beyond and conquer. Like I don't get bogged down in small things, really focusing on what I can do to be healthy in the moment, um, and looking for, ways where I can help other people who went through something similar. It's really hard to. I remember talking with kids who went through this when I was younger, just to have somebody to look up to be like, okay, somebody has done this before, because all the doctors are telling me that they have nobody to essentially compare me to. Um, and so I feel really, really lucky with where I'm at. Not only, where I'm at health wise, but where I'm at in my life. Because that certainly wasn't guaranteed to me when I was younger.
So you've gone through this diagnosis, myeloid leukemia. You've gotten treatment, and it appears you're healthy, or as healthy as you can possibly be, mentally, spiritually, physically. And you decide to work with the American Cancer Society. What was that impetus? Where was that, and where were you?
So I had been kind of involved with the American Cancer Society since I had been diagnosed. They have kind of a platform called Relay for Life, which is one of their signature events. And so I've been doing that locally since I was 7. I had a team of all my friends that we would go, and it was around a track, and we would play football and kickball and soccer and all the things in the middle of the track. And that's what it was to me. That was totally fine. And then as I think my mother did most of the fundraising, and I just kind of went along for the ride, and I thought it was fun because everybody made a big deal. And then in college, I went to St. Joe's, and I actually kind of helped start the Relay for Life there. And that's kind of how I got looped in with the ACS affiliated chapter of the American Cancer Society. And I kind of got an internship in college and never looked back. I've had a couple different roles here, but I've been
Well,
here.
tell us, which roles are they besides the corporate relations?
So I started as a Relay for Life event manager. So I was managing 4 or 5 events that were raising money. And then I've been in the corporate role for about 6 years and kind of in a progressing mode from that, which is really just soliciting and strategic alliances for corporations that are mostly headquartered in the Philadelphia area.
And you know that every dollar that you raise or you ask for, and that is provided with a smile, that it's getting used. How are these dollars getting used? Tell everyone.
I mean, what ways aren't they getting used? I think a lot of things that the ACS does go undetected by a lot of people. Everybody knows about our research, but we have direct services that we're providing patients every day. We have 35 or 36 Hope Lodges now, which are places where—
What is a Hope Lodge?
Hope Lodge is a place where a person and a caregiver can come, a survivor and a caregiver can come and stay free of charge if they're going out of town for treatment. So, think about Philadelphia. We have one just outside of Philadelphia that, of all the medical hubs, you got Penn, Jefferson, all of the different ones that are in this area. Excuse me. People come from all across the world to go there. Yet they may not come here if they cannot stay, and they have to stay in a hotel for $200 a night. Not only is cancer draining physically, but you would be absolutely shocked to see how many people go bankrupt trying to pay for their cancer treatment.
TJ, as a survivor, what would you like to tell our community or anyone who's listening right now?
I mean, I think that although childhood cancer is something that affects a lot of people, it doesn't affect everybody the same. And so you can look at me and I can be doing, very well relatively, but there are so many people younger than me, older than me, that did not have the experience that I did and didn't have the chance to kind of live out their life and their dream. And so it's so important that we continue to not only talk about it, but focus the research, focus on what we can do to alleviate some of the pain and suffering that comes from it, because there is a lot. And when you go through it, it's really hard, but you come out a stronger person. And I firmly believe that. And I mean, I say it, but, and I mean it, I wouldn't change it. But it's certainly something that I deal with every day. There's not a day that goes by that does not somehow I have to figure out something around that I shouldn't as a 30-year-old.
Well said. Well, DJ, I'm going to ask you just to slide over and make room for Dr. Baskies, because he's going to come back. And if you have any questions for the oncologist, and you know him as a friend and a fellow peer with the ACS, Dr. Baskies, if you'll come back.
I'm here.
Dr. Baskies, I have one question before Diana has questions for both of you. As a father, grandfather, for those who are watching right now, what advice can you give them if they have a loved one, a little loved one who's been diagnosed with cancer?
Well, the first thing I can tell you is to be hopeful. Without hope, you have no chance of getting through this. Have trust and confidence that in the physicians and the nurses, and I would emphasize the nurses and the child life specialists who get involved.
What is that? What is a child life specialist?
When children at a cancer center like CHOP, for instance, here in Philadelphia, or when a child's admitted, there's a child life specialist who is a person who's a social worker, could be a nurse, could be both, who kind of is the ringleader, if you will, or the quarterback for the treatment. Right? You'll meet the oncologist, you'll meet the radiation therapist, you'll meet the surgeon or the surgical oncologist, but the child life specialist is somebody that really can interact emotionally with the family and make sure that things are navigated well. Look at them as a navigator, if you will. But more than that, they become part of your family, and they're just an incredibly important part of the team for children. I can tell you that at Lurie Children's, where my granddaughter was treated, the child life specialists were really such an integral and important part of it. But the thing to recognize is that the cure rates and the survival rates for children are excellent. There's a lot of reason to be hopeful. Unfortunately, in our situation, my granddaughter was diagnosed one of 30 children born in the country. Only 30 children a year in the United States had the type of tumor that my granddaughter had. So she was really, we were unfortunate enough to have that bad luck, but that isn't the case for most children. So there's a lot of reason to be hopeful. The treatments are getting better. The research is tremendous, but we need more dollars. And so that's really where the rubber meets the road, is that until we get a better handle on why we are failing in some of these instances of children, we won't be able to make the progress that we need to make.
And it all comes down to dollars, right?
It does. Look, the number one funder of cancer research in the country, in the United States, is the federal government. The second leading funder of cancer research in the United States is the American Cancer Society, which is a volunteer organization with our average dollar raised is $36. And so it's a lot of work to raise that money. But we've invested $5 billion. At least $5 billion in research in cancer. And research in cancer isn't just research in pediatrics or research in adults. What the breakthroughs that have been made are applicable to both groups. So children aren't little adults, they're children. But nevertheless, many of the treatments that we use in children are very similar to the treatments that we use in adults. So any breakthrough that we make can apply to children. And that's one of the reasons why I'm involved with ACS, is that we know that we can make a difference. Let me just point out one other thing to you that is truly amazing. America is an incredible country because we have volunteers who go out and knock on doors and have events to raise money. It's an amazing thing that the government does invest in cancer, but we need more dollars. And the American Cancer Society is very good at recognizing breakthrough research. Let me give you an example. So we have funded 49 Nobel Prize winners. The ACS has funded 40 Nobel Prize winners before anybody even knew who they were in the very, very beginning of their research endeavors. So we're very, very good at recognizing young talent. And we're very proud of that. So we have funded 49 Nobel Prize winners before anybody else did, before the government did, before anybody else even knew who these people were. They submitted a grant. Our external grant reviewers recognized the brilliance that these people had and the potential that they had before anybody did. And that's what we're really proud of. And America doesn't realize what a great job we do with that. And so we fund the research, we fund the mission, we get people rides to the oncology departments and to the surgeon, free of charge. As DJ so aptly pointed out, we have 36 hotels that we don't charge a cent for, that are totally volunteer driven and volunteer funded in the major hubs in the United States. New York City, do you know what a hotel room costs for somebody who's getting a bone marrow transplant at Memorial Sloan Kettering? It's over $400 a day. And if you have to be there for 6 months, do the math. We have 60 rooms in New York City that are occupied all the time by people undergoing cancer treatment from all over the world. In Philadelphia, we have a Hope Lodge where we provide food and lodging for, as GJ mentioned, free of charge to patients and a family member. And it's a beautiful lodge, funded totally by people like you and me and DJ and regular citizens in the United States. We receive no government support. All of the money that we raise, and it's hard to do, especially during COVID, because that's all anybody wants to talk about is COVID. But remember this, COVID will end. Cancer isn't ending, okay? We're going to have this problem for a while. We've made great breakthroughs, but we need more dollars. And we need more dollars for pediatric cancer. And I'm hoping that people listening will recognize the fact that we not only invest in adult cancers, but we invest in breakthrough treatments for children also.
Amen, my brother. Wow. I can see why ACS has put a cape on you. Whoa. DJ, do you have a question for Dr. Baskies or vice versa, Dr. Baskies for DJ? If not, Diana, would you come up, please? I know she has a couple questions.
Hi there. Sorry, little technical glitch. Yes, I do have a few questions. But first, I want to thank Dr. Baskies and DJ for your wonderful stories and for all of your support, because you truly are warriors for the American Cancer Society in so many ways. So as a fellow ACS person, thank you. Dr. Baskies, you brought up the fact that organizations need to collaborate. And you talked about how the American Cancer Society is collaborating with St. Baldrick's. What is your hope for the future of cancer research and collaboration between some of these competing organizations for funds?
You know, one of the things that we have over 8,000 organizations, at least 8,000 various cancer organizations, large and small, all of which are doing in some instances overlapping work, but with the same goals. And so there's value in terms of collaboration and getting together and breaking down barriers that prevent us from working together. So my pitch is that any organization that wants to work with us, get in touch with us and let us work together. We're not trying to put other cancer societies out of business. We're trying to get to the same goal. And between advertising and overhead, those are dollars that can't go into mission. They don't go into research. And we need to get rid of that as a country. We just have, and I think President Biden actually recognized that with the moonshot. That was one of the goals. Unfortunately, we haven't achieved that because everybody wants to do something, but we need to do something together. And that's one of the reasons why we're working with St. Baldrick's. They had the same mission, they had the same goal. They invest in research the same way that we do. We don't just give the money to one hospital. You can be in Podunk, Iowa. You can be in Boise, Idaho. You can be in San Francisco, New York. But if your research is really good, we try to fund it. Okay, we do the best that we can with the limited dollars that we have. And so the $5 billion that we've invested in research, they have made a difference. They're one of the main reasons why our survival rates are as high as they are. You know, if you compare survival rates from breast cancer in England versus the US, ours are over 90%. In England, they're in the high 70s. That's a big difference.
Wow.
Okay.
Dr. Baskies, I want to qualify to make sure everyone heard what you said. He said $5 billion in research, not million, just it's a B, just so you know, and you're hearing this correctly, because he kind of went over that really quickly, but that's what's necessary for the survival rate we have in our country to be at, what did you say, 70% now?
Yeah, the overall survival rate from all cancers, all
Yep.
comers, that's people with stage 1 disease, people with stage 4 disease. If we lump them all together, the overall survival rates are approaching about 70, close to 70%, and getting better every year. We're improving our survival rates by between 1.5% and 2% a year. And although that sounds like a small number, that's a large number of people. It's millions of lives. And
We
millions,
got one right there. There's
Right.
one sitting right next to us.
yeah, and I'm talking to one right now.
Oh yeah, mine was a tiny one
Right.
compared to his.
But you're right, and those add up. So although 1.5% doesn't sound like a lot, there's a lot of work that goes into getting to that 1.5%. And you know, as I pointed out earlier, in breast cancer is a great example. We went from 75% to greater than 90%. It took a while, but that's because people decided to invest in research and making drugs available and prevention and the better tools we have for treatment. And that doesn't happen by accident.
Yeah, and I think to add to that, the overall well-being of patients after they go through cancer has improved dramatically in the last 20 years. You know, you talk about surviving is one thing, but then thriving after is a totally different. And so I think we're healed, and where all of the treatments that mitigate the toxicities of some of the cancers and some of the treatments that, you know, you can come out on the other side better than, you know, you would have 25 years ago. That's something that I'm really vested in, and some of the research that we're doing in other organizations in survivorship is something that is really important to me, because that's my livelihood. And so it's just one of those things that continues down the line.
Yeah, let me emphasize something that DJ just said. So 20 years ago, there was no such thing as navigation. In other words, when you get a diagnosis of cancer now, there's somebody that actually helps you make appointments, gets you through this, is your point person, if you will, in a hospital. It could be a nurse, it could be a social worker, it could be somebody who's got training in terms of getting you through that. Navigation didn't exist. You know who made navigation available? The American Cancer Society. We are the people that started navigation. We made it a priority for that. And we not only invest, by the way, in bench science, but we also invest in psychological and adjunctive therapies, meditation. Does it work? We do research in those areas also. So these are really, really critically important things. It isn't just the surgery. It isn't just the radiation. It isn't just the chemotherapy that people receive. There are other things that need to be done to help a cancer patient get through and to become survivors. Okay, so we right now in the United States, you want to take a guess as to how many survivors there are in the United States today of cancer? Take a guess. Anybody want to come up with a number? What if I told you that it's approaching 15 million people? 15 million out of a population of 330 million. In the next 10 years, that number will jump up to between 20 and 25 million people, which will be almost what? 10% of the population in the United States will be a cancer survivor, somebody who's either been recently diagnosed, treated, or is out there and living with the disease. That's a lot of people. So one of the things we've been able to do is not only cure cancer, but we've been able to make it possible to live with this disease and to make it somewhat chronic, if you will. That doesn't sound great, but it's better than being dead. So, you know, the thing that, and I don't want to be blunt about it, but it's very true. And so,
No, be blunt. Be blunt. This
at
is
the end
good.
of the day, the healed movement is so important. And it's important because people can learn to survive. And that's what that's really what the American Cancer Society is all about. We provide the tools for surviving by giving you treatment. We also make it easier to get through the disease process and then to recognize the importance of survivorship.
We're going to end on that note. Dr. Baskies, Dr. Arnold Baskies, thank you. Thank you very much for joining us. DJ Carlino, we really appreciate you, especially this September Child Cancer Awareness Month. Diana, thank you, Scott, for our producer, 6ABC, our media partner, all leadership partners who have ponied up and are part of this movement, and each and every one of you who are wearing our bracelet proudly and with the spirit intended. I thank you all. I like to end with a prayer. It's a very simple prayer of gratitude. Thank you for the grace in helping me to welcome what is right now. Thank you all. Peace to you.